As the medical team prepared for what everyone knew was likely to be a desperate attempt to save the patient's life, Marcus made a decision that would change everything. He set down his mop, walked over to Dr. Chen, and spoke in a voice that carried an authority none of them had ever heard from him before. "Dr. Chen, I need to speak with you privately." The urgency in his tone was so unexpected that Sarah actually stopped what she was doing and followed him a few steps away from the group. "I know this is going to sound impossible," Marcus said quietly, "but I can perform that surgery. I've done this exact procedure hundreds of times. That patient has maybe 20 minutes before the pressure in her skull causes irreversible brain damage. Dr. Bradley isn't qualified to handle this, and you know it." Sarah stared at him as if he had lost his mind. "Marcus, I don't know what you think you know about neurosurgery, but I know that she has a large acute subdural hematoma with significant mass effect." Marcus interrupted, his voice taking on the clinical precision of someone who had described these conditions thousands of times. "I can see from here that she's developing signs of uncal herniation. Her left pupil is already dilating, which means we have minutes, not 20 minutes. The clinical accuracy of his assessment stopped Sarah cold. Those weren't terms a janitor would know, let alone use correctly. "Who are you?" she whispered. Marcus looked toward the patient, then back at Sarah. For 8 years he had successfully hidden from his past, but watching a young woman die because of pride and protocol wasn't something he could live with. "My name is Dr. Marcus Thompson. Until 8 years ago, I was the chief of neurosurgery at Northwestern Memorial Hospital. I've performed over 3,000 craniotomies in my career, including hundreds exactly like this one. And right now, I'm the only person in this hospital who can save that girl's life." The silence that followed Marcus's revelation was deafening. Dr. Chen stood frozen, her mind racing to process what she had just heard. Dr. Marcus Thompson, she knew that name. Every neurosurgery resident knew that name. He was a legend in the field, the author of surgical techniques they still studied. The surgeon other surgeons talked about in hushed, reverent tones. But that was impossible. Dr. Marcus Thompson had disappeared from the medical community years ago. He certainly wasn't a night janitor at St. Mary's General Hospital. "Prove it," she said finally. Marcus walked over to the patient and began a rapid neurological assessment that demonstrated knowledge no janitor could possibly possess. He checked pupil responses, tested reflexes, evaluated the positioning that indicated increased intracranial pressure, bilateral pupil dilation, decerebrate posturing, and if you look at the latest scan... He gestured toward the CT scan display. "You can see the midline shift is approximately 8 millimeters. The hematoma is located primarily in the temporal region with extension into the parietal area. Based on the mechanism of injury and the presentation, I'd estimate the clot volume at approximately 150 milliliters." Dr. Bradley, who had been listening with growing disbelief, finally erupted. "This is insane. You want to let a janitor perform brain surgery based on what his ability to use medical terminology. I don't care what he claims his background is. He's not credentialed at this hospital." "He's right about the credentialing," Sarah said slowly, her mind working through the impossible situation. "But everything he just said is absolutely correct, and ... She paused, studying Marcus with new eyes. "I've seen pictures of Dr. Marcus Thompson in medical journals. The age would be right." Marcus reached into his wallet and pulled out a worn ID card, his old Northwestern Memorial Hospital physician's badge. The photo was 8 years old, but the resemblance was unmistakable. "Sarah," Marcus said, using her first name for the first time, "I understand the position this puts you in, but that patient is going to die if someone doesn't operate immediately. I'm telling you, I can save her life. The question is whether you're willing to let protocol stand in the way of doing what's right." Dr. Chen found herself facing the most difficult decision of her young career. On one hand, allowing an uncredentialed person to perform surgery in her hospital violated every rule, regulation, and ethical guideline she had sworn to uphold. Her career would be over if things went wrong, and probably over even if they went right. On the other hand, she was looking at a patient who was going to die without immediate intervention, and the only person present with the skills to save her was standing in front of her wearing a janitor's uniform. She looked at the patient's monitor, watching the numbers that told the story of a brain under increasing pressure. She looked at Dr. Bradley, whose confidence couldn't mask his fundamental lack of experience with this level of complexity. She looked at Marcus, whose calm demeanor and clinical knowledge spoke to decades of experience in exactly these situations. "If you really are Dr. Marcus Thompson," she said finally, "then you know what I'm risking by allowing this." "I do," Marcus replied. "And if I really am Dr. Marcus Thompson, then you know I wouldn't ask if I wasn't absolutely certain I could save her." Sarah made her decision. "OR7 is set up for craniotomy," she announced to the team. "Dr. Thompson will be performing the surgery. I'll be assisting." The explosion of protests from Dr. Bradley and several nurses was immediate and loud, but Sarah cut them off with an authority that surprised even her. "This patient is going to die without immediate surgery. Dr. Thompson has identified himself as a board-certified neurosurgeon with extensive experience in this exact procedure. I'm making the decision to proceed." Anyone who is uncomfortable with this can leave now, but we are not letting this patient die because of paperwork. What happened in OR7 over the next 3 hours would become the stuff of hospital legend. Marcus transformed from a quiet janitor into one of the most skilled surgeons any of the staff had ever witnessed. His movements were precise, economical, and completely confident. He positioned the patient's head with the exact angle needed for optimal surgical approach. He made his incision with the steady hand of someone who had done this thousands of times. When he began to remove the skull flap, every movement was purposeful and perfect. Dr. Chen, assisting, found herself learning techniques she had never seen before. Marcus's approach to exposing the dura, his method for controlling bleeding, his technique for evacuating the hematoma, everything was textbook perfect, but with refinements that spoke to decades of experience. "Suction here," Marcus said calmly, his voice taking on the authoritative tone that had once commanded operating rooms across the country. "Sarah, can you retract this section of brain tissue? Very gently, just enough to give me visualization of the posterior extent of the clot." As he worked, Marcus explained each step, turning the emergency surgery into an impromptu masterclass. The key with subdural hematomas this size is complete evacuation without damaging the underlying cortex. See how I'm irrigating as I remove clot that prevents adherent clot from tearing brain tissue when it comes free. Even Dr. Bradley, who had initially refused to participate, found himself drawn into the OR as word spread through the hospital that something extraordinary was happening. He watched in stunned silence as Marcus performed techniques he had only read about in advanced surgical textbooks. The most critical moment came when Marcus had to stop a small arterial bleeder that had been feeding the hematoma. This type of bleeding, if not controlled perfectly, could cause the patient to rebleed after surgery and potentially die despite the successful clot evacuation. "This is the money shot," Marcus murmured, using terminology the younger doctors had never heard from an attending. "If we don't get perfect hemostasis here, she could rebleed within hours of closing." He worked with microscopic precision, using bipolar electrocautery to seal the vessel without damaging surrounding brain tissue. The technique was flawless, the kind of work that separated truly great surgeons from merely competent ones. 3 hours after they had begun, Marcus was placing the final stitches in the scalp incision. The patient's vital signs had been stable throughout the procedure, and her neurological signs were already improving. "She's going to make a full recovery," Marcus announced as he stepped back from the operating table. "No residual deficits, normal cognitive function. She'll be back to her normal life within 6 weeks." For 8 years, the hospital staff knew him as just the night janitor, quiet, humble, always cleaning without complaint. But when a critical brain surgery patient arrived and no neurosurgeon was available, the janitor quietly said, "I can do it." What happened next shocked the entire medical staff and saved a life they thought was lost. Welcome to Forgotten Voices. Before we begin this incredible tale of hidden expertise and second chances, tell me in the comments what city are you watching from today. And if you believe stories like this need to be heard, hit that subscribe button and help us honor the unsung heroes walking among us. St. Mary's General Hospital stood as a beacon of hope in downtown Chicago. Its 20-story structure housing some of the most advanced medical equipment in the Midwest. The neurology wing, located on the 8th floor, buzzed with constant activity, doctors rushing between patient rooms, nurses monitoring critical cases, residents frantically studying for their next exam. But late at night, when the chaos settled into a quiet hum of essential operations, a different figure moved through these halls. Dr. Marcus Thompson, though nobody called him doctor anymore, pushed his cleaning cart with the same methodical precision he had once used to navigate the human brain at 68 years old. Marcus had the weathered hands of someone who had worked with his fingers his entire life. His gray hair was always neatly trimmed, his posture still straight despite years of bending over patient tables. He wore the standard hospital maintenance uniform, navy blue shirt, matching pants, comfortable shoes that had logged thousands of miles through these corridors. What the staff didn't know was that those same hands had once performed miracles. Those fingers had delicately removed brain tumors the size of golf balls, had repaired aneurysms that should have been fatal, had given thousands of patients a second chance at life. Dr. Marcus Thompson had been one of the most renowned neurosurgeons in the country for over 3 decades. He had pioneered surgical techniques that were still being taught in medical schools. His research had been published in every major medical journal. He had trained a generation of neurosurgeons who now ran departments across the nation. But 8 years ago, everything changed. The malpractice lawsuit had been frivolous, a family looking for someone to blame after their elderly father died, from complications that had nothing to do with Marcus's surgical skill. But the legal battle had drained him emotionally and financially. Even though he was eventually cleared of all wrongdoing, the stress had taken its toll. His wife of 40 years had passed away from cancer during the midst of the legal proceedings. His children lived across the country, busy with their own careers. At 60, Marcus found himself alone, burned out, and questioning everything he had dedicated his life to. So, He did something unprecedented for a surgeon of his caliber. He walked away, he sold his practice, paid off his legal bills, and disappeared from the medical community. For a few months he tried retirement, golf courses, reading books, traveling to places he'd never had time to visit during his surgical career. But none of it filled the void. That's when he saw the posting for a night custodian at St. Mary's Hospital. It seemed perfect. He could still be around medicine, still be helpful, but without the crushing pressure and responsibility that had worn him down. The irony wasn't lost on him. After spending his career in the most high-stress environment imaginable, he found peace in the quiet halls of night shift maintenance. Marcus had developed a routine over his 8 years as a janitor. He arrived each evening at 10 p.m. Just as the day shift chaos was winding down, he would change into his uniform, gather his supplies, and begin his methodical journey through the hospital. He started with the emergency department, where the pace never truly slowed. The ER doctors and nurses had grown used to seeing him, offering tired smiles and the occasional "good evening, Marcus." They appreciated his quiet efficiency. He cleaned around their work without getting in the way, somehow anticipating where they needed space before they even knew it themselves. From there, he moved to the general medical floors, checking patient rooms where nurses gave him the all clear. He had a gentle way with patients who were awake, a warm smile, a quiet "how are you feeling tonight?" that somehow managed to be comforting rather than intrusive. But it was the neurology wing where Marcus spent most of his time, and where his presence was most appreciated by the staff. The nurses had come to rely on him not just for cleaning, but as an extra set of experienced eyes. He never diagnosed or treated, but he had an uncanny ability to notice when a patient seemed uncomfortable or when equipment wasn't functioning. Quite right, Dr. Sarah Chen, the chief resident in neurosurgery, had developed a particular appreciation for Marcus's observations. She was brilliant, ambitious, and completely dedicated to her patients. But she was also young and sometimes missed the subtle signs that only came with experience. "Marcus has better instincts than half the residents," she had confided to a colleague. "Once, I don't know what his background is, but he understands this place in a way that most people take years to develop." What she didn't know was that Marcus had worked in hospitals longer than she had been alive. Dr. Jason Bradley was everything Marcus remembered disliking about young surgeons when he had been in charge of training them. Brilliant, yes, but arrogant. Beyond his experience, at 28, Jason was in his third year of neurosurgical residency and already convinced he knew everything worth knowing. Jason treated the hospital support staff with barely concealed condescension. He viewed nurses as subordinates rather than partners, dismissed the concerns of older residents, and seemed to believe that his medical degree made him superior to anyone without one. His attitude toward Marcus was particularly grating. He would drop trash on the floor right after Marcus had cleaned an area, speak about him as if he weren't there, and had once made a joke about "at least someone in this hospital knows their place." Marcus endured it all with patience he had learned through years of dealing with difficult colleagues, families, and yes, residents just like Jason. But sometimes watching the young doctor's careless technique or hearing him dismiss a nurse's valid concern, Marcus had to bite his tongue to keep from intervening. The irony was painful. Jason was exactly the kind of resident Marcus would have straightened out quickly in his teaching days. But now, as a janitor, Marcus had no authority to correct anyone, no matter how obvious their mistakes might be. It was a Thursday night in November when everything Marcus had built over 8 years of quiet anonymity came crashing down. He was finishing up the neurology wing around 2:30 a.m. when the elevator doors burst open and chaos erupted. A trauma team rushed out, wheeling a gurney carrying a young woman who couldn't have been more than 25. She had been in a car accident, and the initial CT scan had revealed massive intracranial bleeding that required immediate surgical intervention. Dr. Chen was leading the team, her face tight with concentration and worry. "Where's Dr. Martinez?" she called out, referring to the attending neurosurgeon who was supposed to be on call. "Still stuck in that multi-car pileup on I-94. One of the nurses responded. "ETA at least 45 minutes. "She doesn't have 45 minutes, Dr. Chen said grimly, looking at the patient's rapidly declining vital signs. Dr. Bradley appeared from one of the patient rooms, having been awakened by the commotion. "I can do it," he said with characteristic confidence. "I've assisted on dozens of these procedures." Dr. Chen looked at him with barely concealed horror. "Jason, you've never been the primary surgeon on a craniotomy this complex. This patient has a massive subdural hematoma with significant midline shift. One wrong move and she's dead." "Then what do you suggest?" Jason shot back. "Let her die while we wait for Martinez. I'm the most qualified person here." Marcus watched this exchange while continuing to mop the floor, his heart racing as he evaluated the patient's condition with eyes trained by decades of experience. He could see what the residents couldn't or wouldn't acknowledge. This wasn't just a difficult surgery. It was a case that required the kind of expertise that came only from years of handling the most complex neurosurgical emergencies, the kind of expertise he had spent his entire career developing. The surgery's success created a crisis for the hospital administration that had no precedent in modern medical practice. On one hand, they had a miraculous surgical outcome that had saved a patient's life. On the other hand, they had allowed an uncredentialed person to perform major surgery in their facility. Dr. Margaret Foster, the chief of staff, called an emergency meeting for the next morning. The participants included Marcus, Dr. Chen, the hospital's legal counsel, and the chief medical officer. Dr. Thompson, Dr. Foster began, "I've spent the night reviewing your background. Your reputation in the neurosurgical community is ... extraordinary. Your disappearance 8 years ago was a mystery that many of us wondered about, but that doesn't change the fact that you performed surgery in this hospital without privileges, without credentialing, and without any of the protocols that exist to protect patients and the institution." Marcus nodded. "I understand the position. This puts everyone in. I never intended for this to happen. I was content to finish my career quietly, out of the spotlight. But I couldn't watch that young woman die when I knew I could save her. The patient is doing remarkably well." Dr. Foster continued. "Her recovery is exceeding all expectations, and her family as well. They're calling it a miracle. From a purely medical standpoint, what you did was extraordinary. From a legal and administrative standpoint, it's a nightmare." The hospital's legal counsel, a sharp woman named Jennifer Walsh, leaned forward. "Dr. Thompson, we need to understand your current legal status. Are there any outstanding malpractice claims, licensing issues, or other concerns we should be aware of?" Marcus shook his head. "My license is still valid. I never let it lapse, though I haven't practiced in 8 years. The malpractice case that contributed to my retirement was resolved completely in my favor. There are no legal issues that would prevent me from practicing medicine." "Then why," Dr. Foster asked, "have you been working as a janitor for 8 years instead of practicing medicine?" Marcus was quiet for a long moment, considering how to explain a decision that even he sometimes questioned. "After my wife died and the lawsuit was finally over, I was exhausted, not just tired, completely burned out on everything medicine represented. The politics, the pressure, the constant life and death decisions. I needed to step away, and I thought it would be temporary." He paused, looking around the room at faces that were hanging on his every word. "But then I found peace in the quiet work. I could still be around medicine, still be helpful, but without the crushing responsibility. For 8 years, I've slept better than I had in the previous 30. Until last night, I thought I was done with surgery forever." What happened next surprised everyone, including Marcus himself. Dr. Foster made an offer. "Dr. Thompson, this hospital has been trying to recruit a senior neurosurgeon for 2 years. We need someone with your level of experience to mentor our residents and handle the most complex cases. Given what we witnessed last night, I'm prepared to offer you a position as our chief of neurosurgery." The offer hung in the air like a challenge. Marcus had spent 8 years convincing himself that he was done with the operating room, done with the pressure and responsibility of being a surgeon, but last night had awakened something in him that he thought was dead forever. The pure joy of using his skills to save a life. The satisfaction of teaching young doctors techniques they had never imagined. The reminder of why he had become a surgeon. "In the first place, I need some time to think about it," Marcus said finally. "Of course," Dr. Foster replied. "But Dr. Thompson, what you did last night reminded all of us why we became doctors. That patient has a future because you refused to let protocol stand in the way of doing what was right. We could use more of that kind of courage in medicine." Over the next few weeks, word of the miracle surgery spread through the medical community. The patient, Jessica Martinez, made a complete recovery and returned to her job as a kindergarten teacher with no neurological deficits whatsoever. Jessica's family wanted to thank the surgeon who had saved her life, but they had been told only that it was Dr. Thompson. When they finally met him, they were confused to learn that their daughter's life had been saved by someone who introduced himself as the hospital janitor. "I don't understand," Jessica's mother said. "Are you a doctor or a janitor?" Marcus smiled, the same quiet smile he had worn while mopping floors for 8 years. "For the past 8 years, I've been a janitor who used to be a doctor. As of next week, I'll be a doctor who remembers what it was like to be a janitor. And I think that might make me a better surgeon than I ever was before." Dr. Chen, who had been promoted to chief resident partly based on her decisive action during the emergency, became Marcus's closest collaborator. She had learned more from watching him operate that one night than from any textbook or lecture she had ever encountered. Even Dr. Bradley, whose arrogance had been thoroughly humbled by witnessing surgical expertise he could barely comprehend, approached Marcus to ask if he could scrub in on future cases. "I want to learn from you," Jason said, his characteristic cockiness replaced by genuine humility. "I've been watching videos of your old surgeries online, and I realize how much I don't know." Marcus agreed, but on one condition. "The first thing you need to learn is that everyone in this hospital, from the neurosurgeons to the janitors, is here for the same reason: to help patients. If you can't treat a cleaning lady with the same respect you show the chief of staff, then you'll never be the kind of surgeon this hospital needs." Dr. Marcus Thompson returned to neurosurgery not as the demanding perfectionist he had once been, but as a mentor who understood that healing involved more than just technical skill. His experience as a janitor had taught him lessons about humility, service, and the value of every person in the hospital ecosystem. He instituted new protocols that gave more authority to experienced nurses, created mentorship programs that paired senior staff with junior residents, and insisted that all medical personnel spend time with support staff to understand how the hospital really functioned. His surgical skills, rather than deteriorating during his 8-year hiatus, seemed to have been refined by time and perspective. Residents came from other hospitals to observe his techniques. Medical journals published case studies of his innovative approaches to complex procedures. But perhaps most importantly, he brought humanity back to a profession that had become increasingly dominated by technology and legal considerations. Medicine is about people taking care of people, he would tell his residents. The moment you forget that the janitor, the cafeteria worker, and the parking attendant are all part of the healing process, you've lost sight of what really matters. Jessica Martinez returned to the hospital 6 months after her surgery for a routine follow-up appointment. Her recovery had been complete. No cognitive deficits, no physical limitations, no reminders of the night she nearly died except for a small scar hidden beneath her hairline. She asked to meet with Dr. Thompson, not knowing the incredible story behind her surgery. "I want to thank you for saving my life," she said simply. "I know that sounds inadequate, but I don't know what else to say." Marcus shook his head. "You don't need to thank me. I was just doing my job. But I heard that you were working as a janitor when this happened, that you hadn't performed surgery in years. Why did you risk everything to help me?" Marcus considered the question, thinking back to that moment when he had set down his mop and revealed his identity. "Because that's what people do for each other," he said finally. "When someone needs help and you have the ability to provide it, you help. It doesn't matter what your job title is or what other people might think. You just do what's right." Jessica nodded, tears in her eyes. "Well, because of what you did, I'm going to be able to see my students graduate from high school. I'm going to be able to dance at my sister's wedding next month. I'm going to be able to have the family I've always wanted. That's not just doing your job, that's giving me my whole life back." The story of Dr. Marcus Thompson became a legend not just at St. Mary's Hospital, but throughout the medical community. It was a reminder that expertise and dedication don't disappear just because someone changes their job title, and that the most important qualities in medicine, compassion, skill, and the courage to do what's right, can't be measured by credentials or hierarchies. Marcus continued working as chief of neurosurgery for 3 more years before retiring again, this time permanently. But his influence on the hospital and on the dozens of residents he trained continued long after he left. The night shift janitor position at St. Mary's was eventually filled by a retired teacher who brought the same quiet dedication to his work that Marcus had shown. And sometimes, when the current medical staff faces a difficult decision, they ask themselves, what would Dr. Thompson do? The answer, more often than not, is simple. Put the patient first, respect everyone you work with, and never let pride stand in the way of doing what's right. Dr. Marcus Thompson proved that. Heroes don't always wear scrubs or carry stethoscopes. Sometimes they wear maintenance uniforms and push mop buckets. But when the moment comes that their skills are needed, they answer the call without hesitation, regardless of the personal cost. Because that's what real doctors do. They heal people no matter what title appears on their name tag. Have you ever met someone like Dr. Marcus Thompson? Someone whose quiet service masked extraordinary expertise. Someone who put helping others above personal recognition. Share their story in the comments below and let us know what city you're watching from. Here, at Forgotten Voices, we believe that the most powerful tales are often hidden in plain sight. If this story moved you, subscribe and share it. Help us ensure that stories of quiet heroism and second chances continue to inspire others to serve with humility and courage. We'll see you in the next story. Until then, remember to look a little closer at the ordinary people around you. You might be standing next to a hero and not even know it.